Okay, great. As everybody is being transferred in from the waiting room, I just want to welcome you all. Thank you for your time over possibly your lunch hour, might be a little before, might be a little bit after, depending on where you are in the US or around the world. Thanks again for your time, and thanks for attending our webinar today. Today I have with me Dr. Diane Mueller, and she is actually a repeat speaker for us. She's given at least one other webinar that I remember, and I think that was the SIBO and IBS Shore one, which is probably still one of our most popular and most watched or rewatched webinars in our portal, Dr. Mueller, which was just fantastic. So we're very excited to have her back today. She is going to be speaking about Lyme disease, and her presentation today is chock full of great information, some case studies, tons of educational content. So comorbidities of Lyme disease, other things to be looking for, mechanisms of the disease, and then of course some treatment discussion. If you're not that familiar with Dr. Mueller, she actually has a personal journey with Lyme disease, recovering from that and co-infections. So she's devoted a lot of her career to the treatment of Lyme for her patients as well. And she has an online training for clinicians called Medicine with Heart Institute. So if you have questions or want more information about that, you can get in contact with her. And I believe you offer, it's both clinical training as well as kind of business and operational. Is that correct, Dr. Mueller?
Correct, exactly.
Awesome, awesome. So she has a very wide speaking history for multiple different organizations, Byron included. And so you've probably heard her name on different mediums as far as some of the well-known supplement companies like Zymogen and Quicksilver, as well as Colorado Association of Naturopathic Doctors, California Association of Naturopathic Doctors, and the National Association of Nutrition Professionals. So in closing, Dr. Mueller is awesome. She is, I think she's going to blow our mind today. I got a sneak peek at her slides, so I'm actually very, very excited to see this. If you do have questions, you can type them into the Q&A or the chat, or you can hold them until the end. We'll probably have 10 to 15 minutes roughly at the end for Dr. Mueller to answer some of your questions. So Dr. Mueller, welcome. And I'm going to go ahead and let you throw your slides up there and we'll get rolling.
Okay, great. And thank you so much for the warm intro. It's so nice to be here with everybody today. And just a couple of things to start off the bat. The first thing that I just want to say to everybody on this call and everybody that'll be listening in the future is that I've been treating Lyme disease for many, many years and have tried a lot of different lab companies prior to Vibrant Wellness coming out with this particular test. And this is the most fabulous test on the market, in my opinion. And I want everybody to know that I'm saying this from a genuine place. Like, I don't make any money from saying this. Vibrant doesn't pay me when people order extra lab tests. So I really want this to come across as like, just from a genuine place around, I just stand behind this lab and this lab company and this test so fully. And just want you guys to know that I don't make any money by saying that. It's just they're a really wonderful company, and I hope you guys will learn a lot from this webinar and utilize this lab. If you guys are interested in additional information, I always do like to give people bonuses for listening to me talk. So if you text chronic fatigue as well as your name and your email to that number, we'll send you a mini series that'll give you some additional information on some of the other hidden root causes beyond Lyme disease and chronic fatigue that we also often see clinicians miss. So that you can text to that number if you are interested in that. So I want to throw up first a case study. So this was a 46-year-old female, mother of 4. She originally came to our clinic with face tingling and no numbness, just this face tingling. She had some fatigue, some depression, some eczema, some pain, some urinary frequency. So I want to ground us here in the question, why would we test for Lyme here? And the answer is that we didn't. So if you look at these symptoms, the reason why I'm presenting this case that seems like fairly general is because I want to make sure that I am imparting on you guys that one of the most important times in testing for Lyme is when people just have like some of these like fairly normal type of dysregulatory symptoms. Nothing's like such a keynote thing for Lyme, such as a tick bite or a rash, or even, even the migrating pain. She had pain, but it wasn't even migrating like we typically see in Lyme. And we didn't start with Lyme tests, but we ended up going there. And the reason we did is because when we ran some of the initial tests and we found some things and we started treating things and we ran repeat labs to show that everything we treated was improving, but yet some of our symptoms were just not changing at all. That was a big keynote for us, and something that I want to make sure that everybody's aware of. We have our big things that we're going to talk about when we test for Lyme, but another reason to test for Lyme is simply if you're doing all the great things, you're doing all these wonderful protocols, and people are not changing, they're not improving, because Lyme is the great mimicker, right? It can look like a lot of different things. So just to quickly go over, like in this particular patient, we did a stool culture, we did some comprehensive blood work, we did some neurological exams. Neurological exams were normal, there was no problem there. The initial labs showed some dysbiosis, some hormone imbalances, and some heart inflammation. So we did a few things right away. We removed gluten, and that was the first thing that started changing things for her. The tingling in her face went away just from that in just 3 weeks. We treated the dysbiosis with mastic gum, some oil of oregano, some grapefruit seed, and some caprylic and butyric acids to dissolve those biofilms. And then we worked with the immune system of the gut using Saccharomyces boulardii. So some other things you guys probably know about, heart health and glandular helps and licorice and pantethine for the adrenals. So these are common types of treatments, right, that will really help to address some of those things we found on tests. And when we retested, we found that some hormones like the free T3 got better. Cortisol was much worse. The cardiac troponin was normal. We saw some changes in our gut, but there was still like this extreme fatigue. There was still this pain. She was complaining about chronically getting sick, and none of that was changing. Like the fatigue was not changing, for example, with the thyroid disorder. So this is basically when we said, you know what, we need to really test for Lyme. And so we'll look at the test. We'll look at Vibrance test here a little bit later on. Now, one of the things I want to help you distinguish is a difference between acute Lyme and chronic Lyme. So the definition we see for chronic Lyme tends to start about 2 to 6 months post-infection. So why is this important? This is important because it's very, very quickly that Lyme will go into this chronic state. And what we mean by chronic Lyme in part is that the type of Lyme, that formation, the morphology of Lyme that we initially contract from that vector, basically that morphology, what will happen to it is it will shift. It will shift its morphology and it will go more interior. It will go deeper into our tissues. And just like its cousin syphilis, the thing with chronic Lyme is it can basically then go dormant for a while, where people think they're better, right? Or sometimes people don't even realize they have Lyme, and it just feels like a flu. It goes dormant into this chronic state. And then later is when people are actually experiencing a lot more of these particular symptoms. So this particular study found that 63% of those, even with Lyme treatment, still have ongoing Lyme symptoms post-treatment. So, just more evidence that Lyme really does go into the chronic state. And I know there's a huge debate in the field, right, on if this happens, but we do see published studies that are evidence of this. This was a data study out of Johns Hopkins. So we are seeing published studies that are showing this. And clinically, I see this all the time. So let's talk about when you're going to want to run Lyme testing and when you're going to want to utilize this. So we have a long list of symptoms. So I'm just going to fly through these really quickly. So rash, history of tick bites, but now we know that ticks are not the only vector. So we know mosquitoes, for example, can be a vector for Lyme disease. So we don't want to just ask somebody, hey, did you have a tick bite that you know of, right? We want to make sure that we are truly thinking outside the box and realize like just about everybody has had a mosquito bite in their life. So it's very, very likely that, that asking for tick history is not going to rule out Lyme disease. So chronic infection, how we differentiate the pain in Lyme from the pain in arthritis most of the time. You know, Lyme is not predictable, but most of the time the pain from Lyme will migrate versus arthritis. People can have good days and bad days, but it's generally going to stay in consistent joints. So beyond doing tests like rheumatoid factor or anti-CCP3, if we're talking about rheumatoid, we want to also think about asking about, does the pain move? So a typical Lyme, thing, and this is not every patient, right? The patient I just described, her pain was not moving, but most commonly, Lyme's going to be in the hip one day, the shoulder one day, the knee another day. So it's going to move all over, and it does this because one of its major food sources is hyaluronic acid, and it will move to different joints to seek out a new source of that hyaluronic acid. Headaches, these headache migraine people that wind up doing so many different treatments and nothing's working, and we try Botox and that doesn't work, like all of these standard types of treatments, right? If you're seeing headaches or migraines that are not responding to normal treatments, that is definitely a big keynote to be testing for Lyme. Neurological dysfunction, brain fog. Some of the dysfunction here, people will describe it as very dissociative. So like when I had Lyme disease, for me, this sort of symptom, and this is what I hear in my clients a lot too, it was almost like my brain was like, in my consciousness was outside of my body. Like I was having an out of body experience and I was looking down on my body. And that was when I was on a big time flare, but there's this almost dissociation between the physical body and the consciousness that is very like between wordly. It's very, very strange. Brain fog, fibromyalgia, emotional dysregulation, sleep disturbances, night sweats. This can be a big keynote, right? So if people come in to your office, say it's a female age 30 and there's a lot of night sweats, like, we might start thinking at certain ages, we might start thinking menopause, right? But if somebody is not at an age where there's menopause, or if you test LH and FSH and those are normal, we want to think, night sweats could be Lyme. Night sweats can also be the co-infection Babesia or mold, and we'll talk a little bit about that later. So the other thing you see on here, right, is when other treatments are not working, right, the great mimicker. So always think about this if things are not working. So other things that I've seen in practice is like waking at 3:30 the middle of the night. Oftentimes we see that Borrelia is in the brain. There is this thing called Lyme rage. Lyme rage is basically very common in the Lyme community, and it's neurological inflammation. And basically what's happening is because of the neurological inflammation, the central nervous system is basically patterned where the threshold of reaction and the threshold of nerve firing has changed, right? And so a small stimulus will actually cause the nerves to fire and create rage because of that. EMF sensitivity, if people are bothered in places where there's more EMFs, if people feel better, if they turn Bluetooth off at night and put their phones in the airplane mode, that sort of thing, that can be a sign of Lyme. Oftentimes there's this very strange vibratory feeling. Bell's palsy, somebody that has Bell's palsy, randomly, that's a common symptom with Lyme, TMJ. Here's another interesting thing, and kind of to bring us back to the intro that Sarah did around even SIBO, is that Lyme will attack the vagus nerve. And while anybody that's watched the SIBO training that I did and treats SIBO, like the vagus nerve is a little bit different than that migrating motor complex that we talk about in SIBO. But of course, the vagus nerve is responsible for parasympathetic control and digestion. And we see that Lyme will attack the vagal nerve, as well as these other infections, Bartonella, which we're going to talk about, and herpes. So if we're seeing gastrointestinal situations and we run all of our great GI tests and we're not seeing anything improve, then we want to think outside the box, right? And we do want to have Lyme in our differential. So Lyme is really interesting in how it spreads throughout the body. It actually binds through platelets, and by binding through platelets, as our blood circulates, that's part of how it's circulating and spreading. Another thing that Lyme does as part of its pathogenesis is it actually increases fibronectin levels. So fibronectin is a protein that basically is going to allow for greater cell adhesion. And when Borrelia increases it, what happens is the Borrelia is then better able to adhere to our cell surfaces. And when it does that, it's more easily able to migrate inside our cells, to travel into our joints, and to spread throughout our body. So a few other things just about the process of Borrelia is drugs only kill them when they're replicating. Borrelia has biofilms. So I know biofilms are clearly very, very talked about in pathology, and Borrelia includes them. So one interesting thing that I find so fascinating about these biofilms, so epinephrine will actually bind to Borrelia biofilms, right? And one of the things we see with Lyme that's really common is this pattern of recurrence where people have not treated, totally completely, for example, from a treatment perspective, or if people are treated really well and like they're healed and everything's working. Lyme, we don't think that Lyme completely ever gets out of our body. We really think of it as, right now in research, it looks to be more like something like mono, right? Where it does live dormant in our body. The research is still not totally conclusive on this, but that's what it's seeming like at this point. And so what tends to happen with stress with Lyme, just like with EBV, is that stress will actually then increase Borrelia activation, right? So Borrelia will become activated with stress. And one of the mechanisms behind why I believe this is happening is because stress is actually going to bind to those biofilms, allow better communication, and that's going to contribute to the proliferation. So, and that's so common. The way I talk to my Lyme patients about Borrelia is that, yes, this is something that you may have for the rest of life, but like I use this and I encourage my patients to use this as an impetus to motivate my self-care, right? Because all of us should be working to, live as stress-reduced lives as possible. All of us should be hopefully eating well and getting good exercise and sleep and food hygiene and water and all these things. But because the ramifications of not doing that is oftentimes reactivation of these horrible symptoms, we can utilize the fact that we have these types of microorganisms inside of us as a motivating factor for us to basically move towards better self-care. So that's how I frame it for my patients that are concerned about having this their whole life. So like I said, it loves hyaluronic acid. We often see that it's in the vitreous humor of the eye, the joints, the teeth. Okay, this is another one of my favorite parts about explaining Lyme disease. So when we think about Borrelia and we think about the DNA, so if I can take you back to Microbiology 101, just for a quick review. So if you remember in Microbiology 101, that bacteria tend to have these circular DNA structures, we call them plasma. So one of the reasons we know that Lyme works very different than other bacteria is, first of all, that its DNA is not circular, it's linear. And another interesting thing about Lyme and its DNA brings us to a conversation around persister cells. So typically what happens with plasma in normal bacteria, if I have bacteria A and bacteria B and they meet up inside of my body, and bacteria A has a resistance, it's developed a resistance to azithromycin. So if bacteria A has that resistance, it's going to actually share a piece of its plasmid with bacteria B, and bacteria B is then going to intake that into its DNA, and it's also going to have that resistance, right? That's how we get bacterial antibiotic resistance. Now, what's so interesting is microscopically, when we look at that new DNA of bacteria B that just had that azithromycin resistance enter its DNA, when we look at that under a microscope, what we wind up seeing is that there's no remnants of that original DNA in that bacteria, right? Everything is morphed. And so what's so unique about Borrelia and its ability to form persister cells, the persister cells are, we have bacteria A, Borrelia A, we have Borrelia B, Borrelia A has formed a resistance, it shares it with Borrelia B. What winds up happening microscopically is we see the change, but we also see some DNA structure that never changes no matter what. And those are persister cells, and that's one of the reasons that why it's thought to be very different and difficult to treat Lyme is because Lyme has these persister cells that a lot of our standard treatments don't work for. Tuberculosis is another example of a bacteria with persister cells, and we know how major tuberculosis is. So Lyme also moves throughout our body because it has flagella for movement, so it's swimming around. And another uniqueness about Lyme as compared to other microorganisms is that it's not responsive to iron. So in the electron transport chain of most bacteria, bacteria, which gives it energy, just like our physiological processes. The electron transport chain of most bacteria use iron. However, with Borrelia, it's not responsive to iron. The electron transport chain uses manganese. And so there is a researcher that actually found that Claritin, the allergy medicine, was useful for the treatment of bacteria. And this was an in vitro study. And what that particular study showed was that Claritin is actually going to starve the Lyme of that manganese. It's not going to allow that manganese to enter the cell, and that will actually influence the killing of Borrelia. So how is Lyme spreading? We know it's spreading, but how is it happening? So there's this songbird in Ontario that is largely infected with larvae of infected ticks, possibly up to 1,000 larvae of these infected ticks at a time. And guess what? As they fly, they drop their larvae in their feces all over the ground. So it's gross, but basically we have these birds flying over us, defecating, and basically spreading Lyme disease. And so then another question is, of course, well, how do the ticks get the spirochetes? So the ticks actually get the spirochetes. This study, and there's not a lot of studies that answer this question, but this study basically found that it's rodents. So rodents are also another problem as far as the spread of Lyme disease. It's not really just the ticks. It's the ticks are often feeding on the rodents, and that's where it's coming from. So the CDC says there's a 325 increase in Lyme percent, and that's since 2015. I'm telling you it's a lot more than this because the diagnostic criteria from the CDC are so very old. And the problem with that is that the diagnostic criteria is not really integrating yet all of the new research that's come out. The diagnostic criteria is about 20 years old. And so there's been a lot of research in Lyme that's come out since then. The diagnostic criteria has not been updated. So just like what we're experiencing with COVID, right? Where it's like, what's happening with these tests, where what is that diagnostic criteria and how many people actually have this particular virus? The same thing is true with Lyme, is that we have been basing our diagnoses on inappropriate diagnostic criteria, and therefore it's been underdiagnosed. So this number is actually a lot higher. We're going to talk about the diagnostic criteria today, so stay with me for that. So 50% of US counties have the black-legged tick. This is just a new strain I wanted you to know about. So Borrelia burgdorferi is the strain that causes Lyme, but we have this new strain of Borrelia that's been showing up called Borrelia miyamotoi, and this is causing relapsing fever, some symptoms that are similar to Lyme. So here's just some other things. I mentioned this already, not a lot of people remember a tick bite. Less than 20% have a rash that looks like a bullseye. Less than 20%, that's huge. We cannot ask people if they have a rash and think that we're gonna have any bearing on ruling out Lyme disease. So another thing I just wanted to point out that this study that I have on the screen in the bottom left there showed is that transmission in this study was shown to happen in just under 16 hours. A lot of people I know if you get on Facebook, Lyme groups are saying, oh, it's 24 hours. It's actually even less than that. And who knows, we might even consider that maybe more research will come out even showing less than 16 hours. So if somebody does have a tick on them, we definitely want to consider Lyme. And I'm always very cautious to say, like, well, we want to just say that we don't have anything to worry about if it's been less than 24 or 16 hours, because we don't totally know this yet. So I would encourage you not to rule out Lyme based upon that. So we see that Lyme, clearly here's basically a increase in the number of cases in the United States. Here's just a map from 2005. Again, this data is old, but this is showing the need for updated data. Okay, so let's move on to the morphologies here. So there's 3 different forms of Lyme. So basically we have the spiral morphology, which is known as the cell wall form. There's a cell wall deficient form, and there's this cyst form. And this is important because it affects treatment. So that's why we're talking about this, because we need to make sure whatever we're doing treatment-wise is affecting all of these things. And I'm going to show you some of the problems we've seen with antibiotics, because one of the things that antibiotics can do is just make some of these forms morph between each other, and we can cause Lyme to basically get into the cyst form. The cyst form is the dormant form. So basically what will happen when we have the morphology into the cyst form, oftentimes people's symptoms will largely improve when Lyme enters the cyst form. But like I said, all we have to have is a stressful event. And then guess what? You know, all of a sudden the cyst form transforms back into the spiral or the L form, and we have symptoms again. Blebs are just an in-between stage between spiral and cyst. The only reason I threw it in here is for those of you guys that like to read research, you will see blebs show up in the literature, and that's basically what that means. So the spiral form is the form that's initially contracted. The challenge with giving doxy at this stage, which is a lot of what's happening right now, is there's studies, and I'm going to show you some of these studies later, that are actually showing that doxy will cause the Lyme, the Borrelia, to move into the cyst form, right? So amoxicillin oftentimes is a better treatment if you are going to go the antibiotic route. We don't tend to go to the antibiotic route in our clinic. I'll talk about that later. But I do like people to at least know this. So if you are somebody that has a tendency to want to use antibiotics, it's good to know dosing, and we'll talk about pros and cons. So the L form is the cell wall deficient form. We can use doxy at this stage and this dose. And then basically the round body form, this is the one that it's like in any hostile condition, Lyme's going to morph into this form. So basically hostile conditions can be antibiotics, temperature changes, oxidative stress, right? That's a big one because there's so many things in the body, and there's so many pesticides and toxins and other infections and things that could create a lot of stress and a lot of oxidative types of conditions in the body. And that can be enough to change the spiral or the L form into the round body. So tinidazole, this is the dose, 500 milligrams BID, 3 days per week for 4 to 6 weeks. So basically, if you are going to use the antibiotic route, I would recommend using all 3 of these at the same time. The reason for that is because what will happen is if we pulse them and do them one at a time, basically the Lyme will just move from one morphology to another when we use one. Then when we use another, say if we're using tinidazole, well, then the Lyme's going to be like, well, if you're not giving me anything for the spiral form to kill me, I'm just going to transfer back into that form, right? So it's not a good plan to use these one at a time. So, okay, so just some research on all the different areas we see Lyme showing up. So brainstem, and basically when I say Lyme showing up, what I'm saying here is all the different areas in our body that we're seeing Lyme affect and Lyme cause inflammation and problems. So brainstem, cardiac vagal tone, causes lipid peroxidation. So we want to think about that, right? With any of our cardiovascular issues, that gosh, maybe there's a Lyme causing all this, lipid peroxidation and leading to things like coronary artery disease. Fibromyalgia, it changes the diaphragm and attacks the diaphragm, which can affect respiration. Clearly it attacks the nerves, can cause seizures. It's been shown to basically be positive in all disease, death. So basically upon autopsy, what we're seeing is that there's Borrelia, there's spirals in the brains of those with Alzheimer's. We've seen it with Parkinson's. We've seen it with multiple sclerosis. So these are big diseases, right? And sometimes when people get this far, there's so much damage done to their brain, to their neurology, that we may not be able to reverse it. But it is definitely good to know that Lyme is a mimicker of dementia. Lyme is a mimicker of these major neurological conditions. And if somebody's been diagnosed with those things, or if they have like a pseudo-diagnosis, we definitely want to be considering Lyme disease. It gets into the cerebrospinal fluid, it can cause arthritis, it can cause lupus. So those are all some specifics, and now this next information is a little more general. So everything you see on these next few slides, this is actually from a data mining study. This data mining study was done on 200 people, and I want to make sure that you understand that the studies that I'm about to show on these next slides, they are correlative, right? This is not causative, but it's important I present this information to you because one, we need a lot more research to actually show, is this causative, is this not, for the slides that are coming. But one of the things that I really want to illustrate is that there are correlations here, right? So while we're in a position where there does need to be a heck of a lot more research done for Lyme disease, we do really want to realize all of these correlative things and be testing for Lyme when we see some of these correlative things come up. So one of the first things to say is that Lyme often is a co-disease of a lot of different infections. And some of this is because being vector-borne, right? Other things, so if it's a vector-borne illness, vectors don't just bite us and they're like, well, I'm only gonna give you Borrelia, like that would be cool, but that's not realistic. So of course they're gonna give, any vector that bites us is gonna give its like conglomeration of everything that it contains and all the different microorganisms. So usually we see with Lyme, it's Lyme plus da 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 da, which is another reason why the test from Vibrant is so amazing, is because they really are considering this and testing for a lot of these other vector-borne illnesses all in the same test. So in this data mining study, what it found was that 71.4% of people also had elevated mold levels. So mold and Lyme are very, very similar in symptoms. And oftentimes, and as the study showed, we should see clinically, people have Lyme disease and they also have mycotoxin illness. And mold illness typically is an immune dysfunction where the immune system is not able to appropriately tag the toxins from mold and eliminate them. Sometimes it can also be mold spores living in the body, so there can be that as well. But what's interesting about and why these two diseases are correlated is because the same genes, there's an overlap, I should say, between the genes that are making it difficult for us to identify mold toxins and eliminate them, and the genes that are making the toxins that Borrelia secretes, and the immune system has a hard time finding those and eliminate those. So we have basically an overlap in the genetics where those that have a difficulty time eliminating mold toxins also have a difficult time eliminating Lyme, Borrelia toxins. And so that's one of the reasons we see a overlap here. And it's definitely worth doing mold tests too. So also look at this, 85% of those with Borrelia in this particular data mining study also had toxic metals. So we really do want to consider toxic metals, and toxic metals can induce biofilm formation. So if there's toxic metals, it can make treating Lyme harder. We also see that with Lyme, there is reactivation of viral infections. So the human endogenous retroviruses, I threw that in here so you guys would get these slides. We don't have time for me to go through much, but the summary of the human endogenous retroviruses, I know you guys know what retroviruses are because of HIV. And to just explain the functionality of retroviruses, I'm going to go back to basic DNA. And so basic DNA, remember that the function of DNA at its most primal, basic, non-elevated level of explaining this is DNA converts to RNA, converts to proteins. So what a retrovirus is at its also base explanatory level is RNA that basically goes backwards. So normally DNA converts to RNA, but with retroviruses, when retroviruses are present, like HIV, the RNA of the retrovirus converts into DNA. That DNA enters our own DNA and basically becomes part of our own genome. Now, for a long time, we thought we had all this junk DNA, and we still think we have junk DNA. But what junk DNA technically is endogenous retroviruses that we are actually born with, that have been passed down with us for generation after generation. And we are concerned that now that we're realizing, because we thought they were junk, now we're realizing that things can actually make the retroviruses wake up. And that can cause all sorts of problems, all sorts of symptoms, because these retroviruses are ingrained into our DNA. So not a problem when they are dormant, but it can cause immunoregulatory deficiencies and problems when they're woken up. Not to the level of HIV, but still causing problems. Now, I'm bringing this up in context of Lyme because Lyme is thought to be one of the things that we're seeing as possibly waking up these human endogenous retroviruses. So the important part of this is to realize again that Lyme is a big picture. There's a lot of different disease processes that are going on with this, a lot of different viral and fungal and microorganism pictures with this, and it could be too that Lyme is waking up our own endogenous retroviruses. So this is more on that data mining study. So the data mining study also showed immune dysfunction, inflammation, toxicity, allergies, enzyme deficiencies, mitochondrial dysfunction, psychological disorders, neurological dysfunction, endocrine disorders, sleep disorders, ANS problems, POTS, GI disorders, liver functions were elevated, pain was there, physical therapy situation. So all of those things were found to be present in that data mining study with people with Lyme. So again, just more evidence on the whole idea of great mimicker. Think about, like, I have Lyme in my differential for almost everybody that walks through the clinic. Like the case I presented at the beginning, we don't always start with Lyme. Like, we start with Lyme when it feels obvious to start with Lyme, migrating pain. definitely start with, tests for Lyme right away. If people have seen a lot of different doctors and have tried a lot of different treatments for various symptoms, start with Lyme right away. Somebody has some fatigue, start with the obvious things. Start with the thyroid, start with the adrenals, look at the normal, start with nutrient deficiencies, right? But we want to, always have Lyme back in our differential for if things are not working. We want to be thinking about this because it does mimic. Okay, so there's a lot of problems with the ELISA and FDA approved test. And so one of the things to bring up is that FDA tests do not have to, the thing with being FDA approved is about having consistency. So that's what this study is showing, is that basically FDA clearance assumes uniformity, but not accuracy of the test, right? So we have everybody talks about, well, ELISA is this FDA approved test. That doesn't mean it's accurate. It just means that, hey, it's uniform in the way it's testing. So another thing to realize about the problem with a lot of tests out there is with the CDC. So basically CDC and Lyme diagnosis, this what you're looking at on the screen is copy and paste from the CDC website. So basically what this is saying is Lyme disease is diagnosed based upon symptoms, physical findings, and the possibility of exposure to infected ticks. Laboratory testing is helpful if used correctly and performed with validated methods. Notice it didn't say laboratory testing is necessary for diagnoses. So this is so interesting, right? So we're using oftentimes this really, really crappy test, this ELISA test that is not good. And the CDC isn't even recommending that we're doing that. Now, I definitely do strongly encourage you guys to use lab testing for this, because it does help to confirm if if somebody does have Lyme disease. But what you want to do is use Vibrant, use this good company. Don't use something like the ELISA when we're saying the CDC isn't even really saying to use it. And FDA approval doesn't even tell us the accuracy of the test. Okay, so I'm gonna go through some of these quickly because I want to make sure we get to the treatment and have a few minutes to answer questions here. So some of these you can just have on the slide deck. So Western blot, basically what we're doing with the Western blot is we're really looking to say, okay, do we have an antigen response to, or do we have an antibody response to antigens? And so that's basically what that is looking for, okay, so these higher purple, these really dark purples, these are antibody responses to the antigens on the Borrelia. So things to know about the test are that IgMs can stay elevated for years because of Lyme being in the cell. And so this is important because Lyme is one of the few microorganisms we cannot say, oh, if we have an IgM that's negative and an IgG that's positive, that does not mean that this person doesn't have an active infection going on. IgMs and IgG should both be treated for Lyme disease, and it could be active and it could be not active, but if they're having symptoms, it's probably active. Then, like anything in lab testing, we have specificity and we have sensitivity, right? And so there's some bands so there's some of these antigen antibody complexes that are the antigens are very, very specific for Borrelia, meaning there's not other microorganisms that are going to trigger that to be a positive. So these highly specific ones, the way that we interpret Lyme is that anybody who has a highly specific band, anybody that has a highly specific band, even one of them, whether it's an IgG or an IgM, is positive for Lyme, because there's really not anything that's going to trigger this besides Lyme. So why do we need to have multiple antibody antigen complexes when things are highly specific? 41 is our most sensitive band in Lyme. Still doesn't trigger all the time, but it will trigger a lot of the time. 41 is pretty non-specific though. So if we see a 41 only and no other bands, that's one that we tend to look at. Viruses can trigger a 41. So if we're not seeing any of the Lyme specific bands be triggered, but we see a 41 show up, then we typically say, okay, this does not look like Lyme, and this looks like a virus, and treat them for a chronic hidden viral infection. Okay, so another just obvious thing about like this ELISA, it's like we see all this research showing that Lyme is, and that the ELISA is not very accurate, right? And you can look through the studies I've put in here. And so what's so strange to me about the CDC results is we use a test that has a high rate of false negatives, like a 66% rate of false negatives. And then we say, okay, well, only if this test that is likely to be negative, only if this test is negative do we go on to utilize a standard conventional Western blot, which is also not a very accurate test, the conventional Western blot. So there's just so many problems. You know, end line here, there's just so many problems with conventional testing. Okay, so then here's what Vibrant's doing. So this, the first thing they're doing, this first thing you see at the top is this VIS-E1. The VIS-E1 is basically a peptide. It's a component of Lyme. And this peptide is more accurate than doing something that is like a standard, say, ELISA test. So basically with a standard type of ELISA test, we're looking for this entire chain. And what we've seen is testing for the C6 peptide more likely shows positive than like a standard type of ELISA. So some people are using actually something called a C6 ELISA test. And then we also see throughout here, we see all of these different bands. Right now we're looking at IgM. So all of these look good, right? So you see the Vibrant results here and then the CDC results. The Vibrant results are going to be different than the CDC results. The Vibrant results have a little bit different criteria, since the CDC criteria is so outdated and so old. I would even recommend you guys, you know, go even stricter criteria and utilize basically, okay, if you see even one of those specific, highly specific bands, treat them for Lyme. And then what you also see here is you see, this is the IgGs, right? So this is an example of, this is not telling us that somebody has moved into a dormant state. If somebody with Lyme has these IgGs that are showing up here, we do want to treat them for Lyme disease, right? So basically the diagnostic criteria that I recommend is if they have any single highly specific band, any one highly specific band in the IgGs or the IgMs that are, you know, positive, treat them. And then if it's not a highly specific band, then use Vibrant's diagnostic criteria here that you see on the bottom of this, where you're basically looking for a combination of the multiple bands here. So we also see that Borrelia, this test uses PCR, right? So we use a combination of our Western blot, our antibody antigen complex, and then we also use this PCR test. So we're more looking at the DNA here. And this is so, so exciting. And one of the things that I like to do for people before they do a test is get them moving, just get them moving a little bit a few days before, get their lymph moving, just in case the Borrelia is intracellular, that it helps to mobilize it into the blood. So it's a little bit more, it's not hugely pertinent because Vibrant is so, so sensitive in their lab testing with their technology, but it's just a nice little extra thing if somebody does feel like they can do some lymphatic work a few days before, just to get their lymph moving and get this out of the intracellular space. It can be also helpful. So other things that we see here is just, so we are looking for some of these other species of Borrelia, which is so unique to Vibrant. I don't see any other lab companies doing this. We also see all of these other microorganisms, all these other vector-borne bugs. So we see these co-infections, which are Babesia, Bartonella. We're looking for these both with looking at immunoglobulin response as well as looking at PCR. We're looking for Anaplasma, Ehrlichia, Mycoplasma, Rickettsia. So there's so many different things. We're in tularemia. There's so many different things that Vibrant is looking for. And this is just a really, really complete test because of that, right? Because people don't tend to get one bug. Every once in a while we'll see it, but it is really important to come up for these. And sometimes I'll be looking for Lyme and it won't be Lyme. It'll just be Bartonella and Babesia, right? Because it doesn't have to be Lyme. It can be a combination of many of these other bugs that are causing the symptoms. Another thing to just let you know about is Vibrant is now offering this, as well as many other types of their tests, through a dried blood spot. So that makes it so much easier, of course. And right now, when we are in our current COVID crisis, of course, that even makes a big difference with allowing for easier home collection and not having to send people out in the world. But even when, even if you're watching this when COVID is over, Obviously, this is one of the easiest things to have people do. So highly recommend, learning more about that. And this is also what's so wonderful is basically the amount of work. And another reason why I love this company is that the amount of work that basically they are doing and Vibrant is doing to validate that they are, that their results are accurate. So basically the CDC has different validation standards than the FDA. So the CDC is much more, looking for sensitivity and specificity and reproducibility. And so these are important factors. And this particular test was submitted to the CDC and passed all of these different areas. So, you can really trust the accuracy of this particular test. So the other thing that I would just, mention here in testing to be very, very thorough is remember that that Borrelia will affect all of these different organs and glands, right? So we want to go after the bug, but one of the things I see people that gets people into some of the biggest trouble with treatment of Lyme is when we're only focused on killing. Like killing is so important, but Borrelia will, I see it cause HPA axis dysregulation, HPG axis dysregulation. It obviously, like I mentioned, it can affect the vagal nerve and the gut and the diaphragm and the heart and the lungs and the nerves and all of these different areas of the body. So it's really important that when we're looking for Borrelia and when we find Borrelia, what we're doing is we're also looking for all of these, we're doing widespread testing, right? And we're looking for all of these different areas in context of the human body and basically to say, okay, is there a thyroid issue? Is there an adrenal issue? Does somebody have SIBO? Does somebody have a GI problem? And Vibrant has a lot of great tests to really help you with some of these other types of areas, doing their neurozoomer to look at neuroinflammation and doing their gut zoomer to look at dysbiosis and gut function. And, there's a lot of great tests that you can utilize through Vibrant to make sure that you're doing very, very whole body picture and you're not just focusing here on Lyme disease. Okay, so from a pharmacological perspective for treatment, we want to basically do things like Doxy. This is how Doxy is prescribed if you're using it. Again, I don't recommend doing Doxy right off the bat because we do see that it does cause that movement from the spiral form into that cyst form. So better is amoxicillin, but this whole triad you see here, this is a good triad to basically say, okay, if you want to use antibiotics, this is basically a prescription you can do that is going to attack all three of those morphologies, right? So that's so important. So here's a study looking at Doxy and the problems with Doxy that I was talking about. This study is also looking to show some of the problems with cephalosporin class of antibiotics. We also see that here's another study showing that Borrelia is surviving with antibiotic treatment. This is just kind of evidence of basically what I already talked about, the creation of round bodies and the movement when we use things like Doxy. Basically, you see this first statement is Doxy reduced the spirochetal structures, which are the S forms, 90%, but increased the number of round bodies forms twofold. So this is why people are using Doxy, is because there's studies that are showing the spirochetal structures, the Lyme form that we originally contract, is being reduced by 90%, which seems big until you realize that it's increasing the round body form by twofold. And this is basically what I'm saying is this is why we want to be very, very careful, because people feel initially better. And then in those types of, once the system is stressed and there's problems with the immune system for any reason, we see the round bodies then can all of a sudden turn back into those spiral forms and cause all sorts of problems. So we tend to, in our clinic, we tend to start largely with herbs. We do that because we just see so much less rates of recurrence in our population. And it's also very interesting because clinically, and what I'm about to say is just clinical observation here, but clinically, I often get people into my clinic who've been treated with really strong antibiotics, sometimes unfortunately for years. And those are the people that tend to get into my clinic and have relapse. Not saying that we can't relapse on herbs, of course it does happen, but it's much more rare. I have somebody come in and say, oh, I'm having a relapse when they've been treated with just herbal medicine. So we do want to make sure in treatment, we do want to use work with biofilm disruptors. I just like people to be aware of NAC. Some biofilm disruptors like NAC are so broad spectrum, they'll disrupt all biofilms, even the good ones. So Borrelia also is mostly intracellular, so some of the herbs can penetrate better than a lot of the antibiotics. And ultrasound, I learned that one from Dietrich Klinghardt in Seattle. Dr. Klinghardt, he basically taught me that ultrasound can help push Lyme into the blood, so that's just another thing to know. We like to push the Borrelia into the blood because that's where antimicrobials are going to be when we take them, right? They're going to move from our intestinal lumen into the bloodstream, so we can use things like ultrasound to push the Lyme into the blood, or hyaluronic acid we can take orally to also push Lyme into the blood because that's going to be its food source. And then what else is in the blood but all of these antimicrobials? So we give the Lyme its food source to help draw Lyme out of the joints into the blood where the antimicrobials are going to be. There's also some studies that have shown that pulsation therapies work and they can be more effective and they can help prevent hiding forms. So we tend to pulse our treatment. So here's just some ideas for you around treatment from a natural perspective. So phages are an idea. Phages are basically viruses that help to kill bacteria. So there's some research. Phages were used many decades ago and then fell out of the population and now are really coming back. And there's some new research about phages as basically helping with helping with bacteria killing, as well as helping with antibiotic resistance, as well as dissolving biofilms. So ozone is another thing you can try. Now, a lot of the herbal therapy that we use effectively, but a lot of the research, from a research-based perspective, a lot of the research is coming from research from killing leptospirosis or killing syphilis, because those are the two microorganisms that are most similar to Borrelia and have been studied more. So that's where a lot of the research comes from. Chinese herbs have been studied actually quite a bit for these microorganisms. So we use a lot of Chinese herbs in our practice, and here's some of them that we use. And then syphilis, these are some of the Chinese herbs that we also use because of the syphilis research. So what we tend to do is we tend to rotate our Chinese herbs. So we basically rotate through these various formulas, and we rotate them because we are trying to make sure that we are keeping people where they are not getting, their body is not, say, desensitizing to the responsiveness. So if you're ever, right now, we are working on getting these are our products, we're working on getting them in some of the major supplement lines. So if you're interested in ever learning more about these products when we have them in some of the more major supplement companies, just send us a text that says Lyme supplement and we'll put you on the list to keep you informed of that. So, but in addition to doing those, using hyaluronic acid, all 3 rounds, again, to get Lyme out of the joints, using grapefruit seed extract is another great one because grapefruit seed extract kills the cyst form. And remember, we really want to work against the cyst form dying. So then other things we use that are on the market, BioPure is a brand. They have a product called Cocktail that works really great for killing Lyme. People will herx, meaning for those of you that don't know that word, I imagine most of you do, but for those of you that don't, herx is that term where we have a die-off from microorganisms and the body cannot keep up with the toxic load from the die-off, and so the toxins build up in the body, can cause a lot of symptoms. So another thing with Lyme treatment is, like, we do want to make sure that people have a way of communicating with us when we are treating Lyme. So, you know, whether that's email, whether that's, you know, having them call your office, you know, we are not open on the weekend. We don't do anything acute care. So for Lyme people, I tend to tell them, like, hey, you know, we don't know what's going to happen here. It's best not to start this medication on a Friday or even a Thursday a lot of times, just in case something happens and you're reacting negatively and you have too large of a die-off. So we tend to start people, especially if we're worried about them being sensitive or they tell us they're sensitive, on some of these herbal or pharmaceutical protocols, if you go that way, Monday, Tuesday, or Wednesday, so they have the ability to, you know, make sure that they know how they're responding and can reach out to our office before the weekend if they need to. So we use everything you see here, the BioPure Cocktail combined with the Cystis tea. We use those at the same time, and then we'll combine it with hyaluronic acid or manganese at this 8 milligram dose. Again, the manganese, we're doing the same thing as we do with the hyaluronic acid. We really want to help people with drawing that Lyme out of the joints. So here's some more protocol. Cemento and Vanderol are awesome. products. They work with the biofilms of Lyme. They do kill Lyme themselves. And then biocidin, for anybody that knows that product, did come out with this study, and the study was cool. It showed that the biocidin actually did kill in vitro, like most Lyme studies are. In vitro, it killed all forms, all 3 morphologies of Lyme. So biocidin is another great product to do there. So you can also use things like cat's claw. We really like the company Quicksilver makes a liposomal cat claw. Again, I don't have any, monetary gains off of saying that. It's just purely that clinically that we've seen good results with that. And again, just combining with that hyaluronic acid. So then taking us back to some basics, focus on the whole body, work on detox. We want to consider using binders like a prime chlorella or a cytodetox silica or other binders like activated charcoal, for example, zeolite. All these different things can be used as binders, and the binders are going to really help get those toxins out. Just remember, you always want to take binders away from food, pharmaceutical, medicine, or other supplements. We want to maximize sleep, of course, as much as possible. One of the things that we're doing in our clinic now is we're also using peptide therapy, and peptide therapy can really, really help people sleep, and it also can help with lowering that inflammation and helping with tissue regeneration. So definitely consider some of the peptide therapy as well. So addressing stress, this is essential, right? We can't just work on all these body things. Like, the thing I really don't like to do for people is, work on all these things in the body and then all of a sudden, like, not talk about stress and not talk about how they're going to cultivate more stress resiliency in their life, because of the fact that, like we said, stress is going to re-exacerbate all of this. So we really want to address stress. We want to teach people to meditate. We do have on our website, we do offer free meditation every week to the greater community. So if anybody is looking for a meditation resource for their clients, we do offer weekly free online live meditations. So if anybody needs help with guided meditations and they don't know how to guide people through that, you can definitely send them our way, and we offer that to for free, just as a supportive thing for our community. So the other thing is that I see, and it's really important to bring up, is attachment to diagnostic labels. Like, I'll hear people say like my Lyme a lot, and people get so attached to these labels, and sometimes the labels are important, right? Because sure, having a diagnosis of Lyme after you have a bazillion different symptoms and nobody can figure out which is wrong is so relieving. And some people get so attached to it that it actually, even saying Lyme, is creating a stress response in their body and really can limit their ability to think of themselves as a healed human being, as somebody that is, in a different place. So we just watch a lot of like the way people are talking about Lyme and try to, work on some of the language they're using, instead of saying like, oh, this is the disease process that is just mine. I just, this is just mine. This is my burden to carry, these sorts of things, that we're really catching in a language like that and just reframing and saying like, yes, this is something that you're experiencing right now. You do have Lyme right now. This does not mean you have to have active Lyme forever. Utilizing placebo effect, we want to consider sensitization. Sensitization is basically where people use medicine, whether pharmaceutical or herbal, for so long, the same thing, and it actually stops working. So that's another reason why we want to make sure to to go through all of the different and rotate all of our different supplements or pharmaceuticals. So if you guys want a lot more details on treatment, please do check out our online training programs. And let me go through this chat here. So there's that number for you for that chronic fatigue series. Yes, and for all of you guys, sorry I was not looking at this chat. I like to answer questions at the end just to keep the flow going. So yes, you will get, I had talked to Sarah beforehand, and she will be posting the slides. So you'll get all of that. And I think that's all. These questions are just more details like that. Do you guys have any other final questions for me? Oh, here's a couple more. So basically, peptide is helpful in Lyme patients. So we're using growth hormone, and we're also using alpha-thymosin. So we're working on, with the alpha-thymosin, we're working on the immune. So that's good. And then how do we address hypercoagulability for patient with Lyme carditis. So basically the idea with that is there's nothing, it's almost like two separate issues, right? So we do want to do all of our normal treatments for hypercoagulability that we would normally do, and we also want to treat Lyme. So it's not to say that it's kind of like saying, like, how am I going to treat SIBO in somebody that has Lyme, right? It's very, very similar. We do want to address the underlying root issues of whatever glands or organs are affected, whatever vessels, and we also want to make sure that we're addressing Lyme as well. So other things to answer, I only have we're pretty much at time, so let me just pick a couple more questions to answer here. So as far as herxing and biofilm busters, so yes, I mean, anytime we're using biofilm busters, anytime we're using any sort of treatment for Lyme, we can get herxing. And I don't see, like, you're basically saying about treating biofilms at different points of the therapy. I'm glad you asked this, because it brings me up to one more point that I really think is important to mention, which is everybody with Lyme is going to respond differently, right? So I would definitely encourage you guys not to basically get so stuck on it has to be herbal and it has to be these herbs and it has to be pharmaceutical or whatever, and just keep your mind as open as possible to as many different treatments as possible, because that's really what's going to get people the best results. And if you do use antibiotic therapy, if that's the route you do decide to go, I definitely would include herbal medicine in there as well. Not necessarily at the same time, but doing something like that 4 to 6 weeks of antibiotic therapy that I threw up, and then also following that with an herbal protocol like this. So I know you guys had more, questions on, like, clarification of the doses. We are out of time today, but just make sure you go onto the Vibrance portal and you can go back and get all the doses. I put the doses and the SIG in there so you guys would have all of those recommendations. And it's been such a pleasure. I really always love helping my colleagues. If I can be of service to you in any way, you know how to get a hold of me. And thank you again, Sarah, and to Vibrant for having me.
Thanks, Dr. Mueller. We definitely appreciate it. So for everyone who asked, if you're not familiar with the portal, that's where you log in to place orders and view labs. There is an educational section of the portal where we post recordings from previous webinars and slides if we have them. So generally it takes 2 to 3 days for those to be up. Usually you also, if you have registered for the webinar, you will get an email that has a link to the recording, like the direct YouTube link, so you can also view it there. There was one other thing. Oh, and also we do have another Lyme or tick-borne oriented webinar next week. So if you have more questions specific to tick-borne co-infections, we do have that coming up. I believe that's next Tuesday with Dr. Casey Kelly. So that one, if some of your questions were a little bit more specific to that, I would definitely recommend that you register and attend that one as well. So again, Dr. Mueller, thank you so much for your time. This was super informative. I know all of us want to go back and re-listen and watch. You went through so fast, but it was such great information. So we really appreciate it. Thank you everyone for tuning in, and hopefully we'll see you again on the one next week. Thanks a lot. Bye-bye.